Hello, everyone, and welcome to our 2021 dfree Leadership Retreat. I am Tamika Stembridge, the Executive Director of the dfree Global Foundation, and it is truly a pleasure for me to be here this morning, one with our title sponsor, but I would say our partners for such a long time, RWJBarnabas Health. It is the largest private employer in the state of New Jersey. And in the season that we're in with COVID and everything going on health-wise, it really is a privilege to be aligned with a medical company and a provider of services to the community that we serve locally in New Jersey, but also, as a thought leader, and you'll hear more about that in so many other areas. And so I'm really excited today to spend some time with Marty Everhart, who is the executive leader in charge of human resources for RWJBanabas Health, and Deanna Vincent, who her role is really unique in the sense that I don't think I've ever seen this title for any of the other companies that I've connected with in the past. She's the Chief Social Justice and Accountability Officer at RWJBarnabas Health. And so if any of those titles give you pause, it is going to be an interesting conversation. I'm very much looking forward to being with you all. So thank you so much for joining us for this conversation today.
Thank you.
Thank you.
Excellent. Well, to kick things off, I shared your titles, but if each of you could just take a moment to tell me a little bit about yourself, your role with RWJBH, and your experience and connection to dfree. Deanna, let's start with you.
Okay, sure. As Tamika said, Deanna Vincent, I've been with the system for 3 years now. I am a native Trentonian. I am a mother and a wife. I always like to say that first because those are my two most important roles. With the system, I oversee a few things. First, integrating social factors into the clinical setting, meaning that we are looking at a person's whole health. So we know that when someone comes in, we can't just ask them about their clinical areas, but also about social factors. So we can't give a person a medication that says take with food without also asking them, do they know how to prepare healthy foods? Is there food in their neighborhood? Are there grocery stores? We need to look at the whole person. The other pieces of my job are looking at affordable housing. And then the final piece is ending racism. My experience has been in the social sector as well as the government sector, looking at a whole range of issue areas: maternal child health planning, housing. I oversaw the Center on Hispanic Policy, Division on Women, education, and most recently, using big data to help low-income people access public benefits. Thank you.
Wow. That is awesome. And Marty, I have an affinity for the role that you have. I'm a former HR girl in a past life. And so your role as the lead for human resources of such a huge organization is truly important. Tell our audience a little bit about yourself.
Sure. Marty Everhart, and I have the pleasure to serve as the Chief Human Resources Officer for our system, which means I work with a lot of good people. Since we have over 35,000 employees across the state of New Jersey. And with that honor, of course, comes a responsibility to understand what is it that our people really need. And I realize this is a dfree event, but I will tell you, dfree filled a major void in what we were providing to our staff, because we were really missing something major, and we'll get to that later. So I've been in this business way too long, as you can tell by the color of my hair. But I will tell you, every day that I work here, I have opportunities to do things only that I've dreamed of in other places. We have many developmental opportunities for our staff, and we have about 800 people that are in formal advancement programs. And although that may sound small against a background of 35,000 people, that was zero 3 years ago. We have examples where we are actually changing people's lives by the education that we have available to them and the new roles that they can accept. But yes, I'm an HR person by trade. has some operations experience along the way, but primarily this has been my work, and I've been in New Jersey since 2008. And I will tell you, it has been a tremendous, tremendous learning experience, and an opening for me to really learn about what it takes to work with a population that is diverse, truly diverse. And I always tell the story. I started out at RWJ New Brunswick at the Academic Medical Center as their HR leader in 2008. And I tell the story of starting there in November and going to an employee event in December. That was a holiday celebration where there was free lunch. And there's a very large space there to serve a lot of people. Like, we can get up to 1,000 employees in this space for lunch at one time. And every employee that came in to that event, there was a big world map, and they put pins, push pins, in the world map where they came from. And I looked at that at the end of the day and said, I don't even know where half of these places are. You know, and now I know that we have people that came from there. So it was like, wow, do I have a lot to learn? And New Jersey's been very good to me from that perspective.
Excellent. What I heard from both of you in different ways was both, you know, an honor and the opportunity to lead in the spaces that you're in, but also, you know, a huge responsibility to the people that you're serving, both internal to the system and external. You know, I wouldn't be Miss dfree if I didn't ask the question. You know, the work that we do is around financial empowerment. And Deanna, to your point, around holistic financial empowerment, knowing that money issues aren't always just money issues. And so, based on your respective roles and experience, can you tell me why you think dfree is important to RWJBH as the state's largest private employer, whether it's internal to your employees or external to the community that you all serve? And Marty, we'll start with you.
Oh, thank you. So if you would have asked me that question 4 years ago, I would have said, we stay away from anything to deal with that deals with our employees' personal finances. Yes, we encourage them to save for their retirement, but you stay away from the personal issues. What we've learned since the time we've been with dfree, which I believe is about 3.5 years now, and we have a pretty substantial take rate and a completion rate. And if you look at that, you will see that it is people from all walks of life who need this type of assistance. And there was a survey recently done by the Institute for Corporate Productivity, and it said, what are those top 3 things that employees are looking for? And the first one is, look, they need to have a safe environment. Yeah. Number 2, they need to have a psychologically healthy environment. And third, they need to have an employer that cares about their financial health. And when I saw that last week or 2 weeks ago, I was like, it confirms why that utilization is where it is. And it really confirmed why we're going to not only continue with what we're doing with dfree, but we will definitely continue to expand to encourage our employees to take advantage of the opportunity.
Excellent. I am honored to continue partnering with you all. Deanna, how about you and in your work?
Sure. And I just have to echo Marty's sentiments. It's really around, we spend so much time in our work environments. And so many of us, I've had the opportunity, and it sounds to me like Marty feels the same. I've had the opportunity in my career that I feel as if I get to passion every day. And I think most people want to feel like that because we spend so much time in our work environments, and people want to feel respected, and they also want to feel like a part of the fabric of an organization. So therefore, we need to provide a full, well-rounded culture. Mm-hmm. And I think dfree allows us to provide them with an added benefit. Yeah. to really help them build their financial portfolio. And in both my roles, really from a looking at social factors as well as in ending racism, it's really about helping people get up the next rung, and regardless of what level you're at, making sure that you have a level of financial freedom. And those are the types of things that we can provide to our employees that lead to retention.
Yeah.
We want to make sure that people want to stay with RWJBH. And that's really critical as we continue to grow and strengthen our workforce.
Absolutely. I was really excited. I was a part of the initial planning to get your dfree online academy experience set up. And then I also had the pleasure of going back to look at some of the data, and we look at just basic demographics to see kind of who's taking the course. And I was somewhat shocked because, Marty, to your point, it spans the gamut. You know, you would think that it's people, you know, that may be at the lower income spectrum that need it the most. But the reality is I was really impressed that it was across earning levels, it was across levels, it was across races, it was across gender. It really showed me that what we're talking about is beneficial to everyone. And it's critical at any level to really be considering your finances. And even if you think you're okay, you know, a lot of people indicated they're saving, they're planning for retirement, but it gave me the indication that people can never be too sure, especially in the economic and social environment that we're living in, is that, you know, you may have been okay yesterday, but God forbid something happens in the world. Am I still okay today? And so it was really confirming and affirming for me to see that we do have, you know, a program that really speaks to people at different levels. I want to switch gears a little bit, and this is one of my personally favorite questions. From your perspective, what is the connection between physical health and financial health? Does it show up internally with your employees or externally with the community? What are some of those connections that you see? And Deanna, we'll start with you.
Sure, I think there's a huge linkage between physical health and financial health. We know that communities or individuals who are financially stressed, that it shows up in their physical health, that they will be physically stressed. And we know what physical stress does to the body. We know that it's wearing, that it's weathering, and when people are weathered, meaning that there's chronic stress, so every day it erodes at them, that it leads to, as I said, chronic health conditions. So, and that leads to premature death. And we know that it manifests itself many times in populations of color, but it can manifest itself across the board.
Yeah.
And we see it in a lot of times in lower income communities because there is that financial stress.
Yeah.
And so there is direct correlation, and we see it, you asked about in our employees, and our employees are a part of our communities. They're not exempt. So we see it across the board. There is no difference. They are directly correlated.
Excellent. Marty, how about you from an HR perspective?
Yeah, absolutely. And I'd like to add there's psychological health as well into that. You know, as an organization, we are a high reliability organization, which means safety is our first priority for our patients, for our staff and our visitors. And if you're distracted, it is hard to practice safety as a way of life when you have all these other distractions that are weighing on you. And they are distractions that we could potentially help you to deal with. And one of those distractions, unfortunately, is financial. I think Deanna said it. It never comes off of your mind. It's always there, and it wears you down physically. And if you're psychologically worn down and physically worn down, what happens to the safety of our patients? What happens to the safety of that employee? That gets in jeopardy very quickly. So I'm tying this right into a business need in order for us to deliver our promise to our communities. And that promise comes from things that we need to do better to make sure our staff are not distracted based on what's going on. And something that if you asked me 5 years ago, I would have put my head in the sand and said, not my issue. That's people's personal issues, right? As I said before, wrong decision, Marty. Better decision is we need to approach what we can do to help the whole person. And I also want you to know that one thing that dfree has done is given us information, and we've actually redesigned our whole approach to get people to save money for retirement. So that information that you have given us has been really effective in enhancing what our employees are doing for the future, because it's helping them with their current situation. And now they can even begin to think about what does the future look like.
Future looks like. Oh, you guys warm my heart. I did not pay them to say any of this. We couldn't buy this kind of promotion, but it's real. You know, it's not lost on me that, you know, as a health system, you guys are critical to the overall care of people at a most basic level. You're not a bank, you're not, you know, car salesman. You are really dealing with the care of people, both internally and externally. And so I want to turn our attention a little bit to this concept of social determinants of health. It felt really fancy when I saw it written the first time. It was something I didn't necessarily think about, even though, you know, as a woman of color, I do see it. But RWJBH has really taken a great, strong stance on really understanding and trying to figure out how to implement programming to really take care of the total person. So Deanna, can you talk to us a little bit more about the system's approach to social determinants of health?
Definitely. So we have taken an extremely proactive stance on social determinants, and we are eventually, and it's an iterative approach, but our plan is to conduct universal social determinants of health screening, meaning that anyone who comes into our doors will be screened for social determinants of health. And meaning about their what they eat, where they live, whether they feel safe at home, whether they feel isolated, all of these things, because they all have a bearing on our health. And the reason we chose to ask everyone is because we wanted to think about bias and stigma. And we never wanted to put our clinicians in a place where they needed to decide who to ask. And I use myself as an example always. So as I said, I grew up in Trenton, and I used to be, I guess probably 15 or 16 years ago, I was 120 pounds heavier. And I cost my health insurance a lot of money. I am an asthmatic. My dad is a diabetic. His father died of diabetes. My mother has heart disease, and her mother died of heart disease. I am a woman of color. And none of my doctors said, you should probably lose weight. But the very first thing I told you today is that I am a mother and I am a wife. And I promised both of those people, my husband and my daughter, forever. And forever was not then.
Yeah.
So I needed to do something. And I also knew that if my doctor asked me how I would feel when he did not ask the person next to me. So we decided we were going to ask everyone about their social determinants. And we know that we all have them. 80% of all health outcomes are due to social and behavioral factors, which is the majority of our health outcomes. So we have created a system, and it is still in the rollout phase, where we ask everyone, and they can answer these questions in a multitude of ways on their smartphones, in the waiting room. We have a vendor who will make calls so that we can help people address these issues. We're also educating our patients that we will be asking these questions, because it's uncomfortable for a doctor to say, can you afford food? And we know from experience that people may tend to not answer honestly because they fear what may happen if they tell the doctor, I can't afford food. So we are putting all of these things in place. And eventually it should just be a part of routine care, height, weight, blood pressure, and ask these questions, because we have to do this in order to create healthier communities. We have no choice.
Wow. That is holistic healthcare from top to bottom. Everything that you bring with you into the office has to come with you into the office. Marty, your thoughts on social determinants of health?
You know, I learn a lot from Deanna every time I speak with her on social determinants of health. And, you know, it's hard to believe that I have employees that don't have enough money for food. Right. And it is absolutely true. They don't, because we know what the utilization of dfree is and what they're living through. And it is, again, you look at me, I've been around a long time, and it's that, wow, how do we get at it that Deanna is creating? And that's truly exciting, that there's a way to get at this in a way that doesn't embarrass anyone, that doesn't put anyone on the spot. And it gives us as an employer an opportunity to think a little differently about how we truly try to help with those situations, not to, you know, keep giving people a fish, but to teach them how to fish would be the vernacular. And so I'm just tagging along, hanging on to Deanna and saying, okay, go, go, go.
No, this is really good. And I think, you know, without putting my own opinion on it, I think there's definitely, you know, great learning opportunities, even for individuals coming into, you know, health environments, and really understanding all that comes with them is a part of being able to treat them effectively. And so I applaud the efforts of your system to really make that a part of the way you treat everyone. Because I mean, you know, I live in a suburban neighborhood, but there are things that I see here that could be very similar to what we see in urban neighborhoods. You know, we all eat McDonald's. McDonald's is everywhere. And so if that's your primary diet, that is, you know, for sure a part of the social determinants of health that none of us can really escape. And so I applaud you all for really taking this holistic approach.
Right. And if I could just jump in, what I failed to say is not only are we asking, once we ask and someone says they have a social determinant, we're connecting people to services and supports. I mean, you can't ask the question and just say, okay, great. So right. How do we connect them and ensure that they get the services, the same as if someone received a positive blood test for a chronic illness, you know, and then it becomes a part of their health record, because that's just as critical.
Absolutely. I love that. So it's not research. It's
no, it's not research. It is a piece of the puzzle. It's a prescription, just like anything else. And then how do we also work with our external partners and internal partners to streamline access? So for instance, how do we use the information we already have? I mean, we have name, address, and other things to ensure that someone doesn't have to fill out another application somewhere else, because we don't want people to have to do more work than they need to.
You guys are tackling world peace, world issues, if you can figure out how to keep people from having to give data multiple times. I mean, it's a small thing, but it is a big thing when you're trying to help people. We're coming close to the end of our interview, but I couldn't go further without, you know, putting an unfortunate spotlight on 2020. Not only did we experience the beginning of COVID-19 and we're still living through it, but we had global upset. We had, you know, in response to racial injustice, you know, all sparked by the unfortunate murder of George Floyd. And I have to tell you, even from last year, you guys have really taken a serious stance in response to social and racial injustice. Can you discuss some of the anti-racism work that the system is doing? Marty, we'll start with you.
Sure, thank you. You know, the past 18 months and before 18 months, the year of our real pandemic, I called it a career in a year. Mm-hmm. And there were so many learnings and there were so many new experiences that even your experiences couldn't figure out how to deal with them. And so we had changes happening that we have never seen, and at the speed that they were occurring, we had never seen before. And I'll give you one example of something that truly opened up not only my eyes, but the opportunities that probably as an HR leader, I felt free enough to finally do something about what's happening with individual and systemic racism as an employer. I have here, this is the memo from our CEO dated June 1st, 2020, and it dealt with the national unrest, and it dealt with our approach to dealing with individual, structural, and systemic racism, and how that was now a priority for our organization. And that's actually more freeing than you can ever believe for somebody in my role, because it meant we can really dig deep into what's happening in our work, in our own workforce. You know, right? Deanna has the communities, but even in our own workforce, what's happening, and divvying it by race, by gender, you name it. It was like dig, dig, dig. And so we started to dig, and we didn't like some of the results. But you know what? Now it's in the open.
Yeah.
You know what? We know where those issues are, and we found out there's no easy fix, right? But we have goals in 21 addressing systemic and structural racism in our own organization for our employees. So we went from, no, I'm not going to touch that, to it's a goal for all of our leaders that they will actually earn a bonus or not based on their accomplishments of those goals. So you go from June of 2020 of saying, this is who we think we need to be. And in January 21, it's in our goals for improvement. And we found that, you know, with Blacks and African-American employees, somehow they get written up at twice the rate of the population they make up of our workforce. Yeah, we can say that out loud now, right? Yeah. It's a priority for us to say, what the heck is going on? How are we fixing it? And the second priority we set for this year was, if you were separated from our organization, you could end up on a list that says, you're never going to be rehired again. Wow. Never. Oh, that was happening to our Black population at a rate of 2.5 times the population of the workforce. Wow. The second one, we got fixed pretty quickly. The first one we haven't fixed yet because we got to help 2,500 managers in dealing with that. That'll take us a little bit more time. But I'm just saying, it was an opportunity for us to really take apart what's happening on what appears to be facially neutral policies that turn out to be something that turns out to a permanent prevention of a key component of our workforce and a key component of our community not being invited back in because of something that happened, right? That they cannot reapply here and be rehired here, right? Wow. So I can go on, and Deanna would be like, "Oh, he's going to go on and on." But it really I keep this memo with me everywhere I go, and I never let go of this with my HR leaders across the system. It is vital for us to live up to these expectations.
That's brave. That is corporate bravery, if I've ever seen it. Thank you, thank you, thank you. And Deanna, I know this is near and dear to your heart. This is your work. This is your work.
This is near and dear to my heart. As I said earlier, I am a woman of color. Race has always been a huge topic of conversation in my house. My dad is of mixed race, and my mother was very active in the civil rights movement, having gone to prison for integrating a movie theater in 1963. And when I was asked to take this on, I thought about it like, is the system really going to do this for real or not? Or is it lip service? And I was asked this too by several of my colleagues, and the system is doing it for real. And while it's hard, but we've made this commitment, and our president and CEO is committed to this work. We're in the process of, and I know people say strategic plan, but I am a planner by nature and a data nerd. But we are in the process of rolling out our strategic plan right now after months of really digging into the data to see, as Marty said, where does the data for employee, what does that look like for employees, for our community, for our patients? And we have 4 goals. The first being around our patients and our clinical care, to make sure that we have an anti-racist environment for our patients. The second around our workforce, so our employees, our contracted doctors, to make sure that they can thrive in an anti-racist environment. The third is around our community, to really think about those social determinants, to think about how we could be anchor institutions in our community. And then the fourth is around our operations, to think about all those departments that bolster the first 3. So our marketing and communications, to make sure that it is reflective of our communities, not just faces that don't reflect our communities, not just light-skinned Black people, but the entire beautiful hue that's reflective of all of our skin tones. Our legal department, to make sure that our boilerplate language commits our partners to being anti-racist. So all of these areas, and how we're doing this is we are having mandatory training for all of our workforce, because we think it's important. So that will happen, as well as we are auditing all of our policies and procedures across the organization, not just those that are about race and racism, because that is not how you cure systemic racism. You cure systemic racism by looking at all of them and making sure that they are promoting equity, because things are either equity promoting or equity thwarting. There's nothing in between. And we have the true commitment from our board and from our executive leadership to move this forward. So we have been having great conversations about race and equity here. And as Marty said, it has been freeing to have these kinds of conversations that historically you don't have at work. And it ties very nicely into being a high reliability organization, because a racist organization isn't a safe organization. You need to make sure that we are treating all patients the same, all employees the same, because if we are not a team, then we can't treat our patients with safety. We are going to have an anti-racist hotline. So when patients are not treated fairly, because I've been on the side of being a patient and an employee during my lifetime. And as I'm sure almost every person of color can attest to, it's every day. It is every day. The microaggressions, the macroaggressions, all of it, it wears at you. And as we said earlier, it takes a toll on your spirit, and it takes a toll on your body. So those are the things that we're doing. We invite everyone to hold us accountable, hence my title, accountability officer. We are, as Marty said, we are holding ourselves accountable, both in our actions every day and in our pocketbooks. So we ask everyone to hold us accountable.
This is just incredible. I don't think I've ever, and I'm a former corporate girl, have ever seen an organization be this brave and be this forthright about issues that are really essential and critical to the way we move forward, but that are so close to literally, like, you hold life and death in your hands in the work that, the system does, on its face. But you guys have really been brave about some really, really tough issues. And so I applaud the work. I'm honored to be a partner with RWJBH from a dfree perspective. And you guys have shared so much of your organization with us today. As we close out, we've covered so much. How can we encourage our community, the audience that's listening, to either advocate for themselves in health spaces or even advocating for themselves within their employment situations? You guys are the corporate example during our conference. And so not every organization looks like RWJBH. Not every organization is taking these issues head on. What would you say to our community to help encourage them to take what they've learned today into the spaces that they're going into in their own lives? Marty, we'll start with you.
I guess I would say that every action starts with 1 foot forward. Make that one step. It'll be followed by a second step and then a third step. And it may feel a little uncomfortable for those first few steps, but you will see people will come along. They may not understand for a while. I'm still trying to understand all of it myself. But if you sit back and you wait for something perfect to come out, like our CEO's email or our memo, that may not happen. It doesn't mean that you can't take other actions to help your community. I consider our employees our community, and also our greater community that we serve.
Absolutely.
I would just have to say, don't be afraid to speak up. Speak up and be your own advocate. And sometimes it's scary, but no one's going to speak up for you. I think a lot of times, especially I think in communities of color, you're taught that the doctor's always right or the pastor's always right, or you have to advocate for yourself. And then the other piece of it is look for allies. Yeah. And I think that is, as we're coming along in this journey, we're finding allies, because if it was up to Black and brown people, racism would be gone a long time ago. We'd say, oh, this isn't fair. We don't want to do this anymore. But that's not how it happens. We cannot end racism on our own. It's going to take people in the majority to help us do this. It's going to take people like Marty to, when we're sitting in a meeting and my ideas are shut down or I'm not allowed to speak, to say, hey, I think Deanna was trying to say something. And as horrible as that is in 2021, and it shouldn't be, I need him to do that.
Yeah. So
we need to find allies and count on them to help us break through the noise. That's a suggestion.
I want to thank both of you for taking time out of your schedules to connect with us today. This is just one example of the kinds of partnerships that dfree strives to create. We're here to serve you, whether you're a church, an organization, a corporation who's looking to, help people to be fully empowered. dfree is about financial empowerment, but as you can see, we connect in a lot of different ways, and financial well-being is really at the core of so much of how we live our lives. We would love to be able to connect with organizations to help you do what you do better. Marty, Deanna, I thank you so much for your partnership, and we look forward to extending our dfree Academy experience and for sharing more opportunities. And I look forward to hearing the outcomes of all the work that you're doing. Thank you guys so much for your time today, and we look forward to hearing from you soon.
Thank you.
Thank you, Tamika. It's always a pleasure. Deanna, good to see you.
Excellent.
All
Mission
right.
accomplished. Thank you guys so much.
All right. Thank you.
Take
Bye-bye.
care.
All right.
Bye-bye.
Bye-bye now.
Wow, I'm sure you agree that discussion, that conversation was absolutely fantastic. Let me thank Barry Ostrowski, the RWJBarnabas Health System and Management for all of the support they've given us, not just today, but 12 months out of the year. RWJ is always available to support us, even in our financial work, because they understand, as you've heard, that the job of a healthcare system is more than treating sick people. In fact, RWJBarnabas Health has as its core mission preventing people from getting sick. That's a whole new model. It's a whole new mission, and it's why they've deemed it appropriate to be a part of the dfree movement, and they're the first large employer to invite dfree into their ranks and offer it to their employees for free as a benefit of working in their institution. So thank you so much, and hopefully you've heard something that you can take back to your job and present to your human resources department, or perhaps you can take it back to your business, because dfree has a version. When I say a version, we have instructional materials that adapt all of the principles of getting started, getting control, getting ahead, and giving back in a way that's appropriate for a secular workplace. So thank you again to RWJBanabas Health. Thank you to Tamika Stembridge, our executive director, for facilitating that conversation. And the takeaway is this: dfree is good for the workplace. And if people are healthy, they'll work better. And if people are financially secure, they'll be more healthy and they'll work better. It all goes together. So thanks so much. And now get ready for the next presentation.